Hello, my name is MAddy Campellone, and today I will be presenting on adult ADHD, focusing on the prevalence, treatment, and emerging AI applications. This presentation is designed for public health stakeholders, including health educators, mental health practitioners, and policymakers. Together, let's explore how research from 2020 to 2025 informs current understanding and action in adult ADHD care. The goal of this project is to synthesize recent evidence on adult ADHD, covering prevalence, diagnostic tools, pharmacologic and behavioral treatments, and emerging AI interventions. ADHD, or attention deficit hyperactivity disorder, is a neurodevelopmental disorder characterized by inattention, impulsivity, and hyperactivity. While historically considered a childhood condition, it persists into adulthood for many individuals. Adult ADHD is often underdiagnosed or misdiagnosed due to overlapping symptoms with anxiety, depression, or other conditions. This matters because adult ADHD impacts employment, relationships, mental and physical health, and creates economic and emotional strain on individuals, families, and society. Globally, about 3% of adults have ADHD. Health disparities exist in adult ADHD diagnosis. In terms of person or peoples, males are diagnosed more frequently, while females and older adults are often overlooked. Regarding place, adults in rural or low-income areas have limited access to care, whereas urban areas show higher diagnostic rates due to specialist availability. Over time, diagnoses have risen post-COVID, partly due to increased telehealth screening. These disparities demonstrate the need for equitable access to diagnosis and treatment across populations. To conduct this review, I searched PubMed and Google Scholar using keywords such as adult ADHD, prevalence, treatment, and AI. I focused on studies published from 2020 to 2025, including randomized controlled trials, systematic reviews, reports, and news articles. National sources like the CDC, or the Centers for Disease Control and Prevention, NIMH, or National Institute of Mental Health, and the WHO, or World Health Organization, provided prevalence and cost data. Globally, adult ADHD affects about 3% of the population, and in the US, prevalence is around 6%. Women and older adults remain underdiagnosed, highlighting the need for awareness and screening. As you can see in the figure, global prevalence is consistent across multiple regions, emphasizing that adult ADHD is a worldwide public health concern. In my review, I found that stimulant medications are the most effective treatment, reducing core symptoms, but they do carry some cardiovascular risks. Non-stimulant medications are safer, but are often less effective than stimulant medications. Individualized treatment plans are important to balance efficacy, side effects, and patient preference for the best results possible. Behavioral interventions, particularly cognitive behavioral therapy, or CBT, improve attention, organization, and emotional regulation. Various mindfulness practices enhance focus and emotional and self-control. Long-term benefits are strongest when behavioral treatments are combined with medication and mindfulness practices supporting integrated care approaches. Digital health and AI applications are emerging in adult ADHD care. AI-assisted diagnostics using EEG and MRI data are being used to improve accuracy. Machine learning can help with early detection and tracking symptoms accurately, while uses of digital cognitive physical training programs also show improvements in attention. These tools can lead to faster diagnoses, more personalized care, and overall expand access, especially in those underserved areas. Adult ADHD carries significant economic as well as emotional burdens. Lost productivity in the US is estimated at $77 billion annually. Factors including healthcare costs and limited insurance coverage for adult ADHD therapy can add strain. Emotionally, adults and their families experience stress, burnout, and impacts on self-esteem and relationships. Two of the main public health implications I found of importance are to increase awareness and training among healthcare professionals to improve the recognition and early intervention of ADHD, and also reducing access to disparities through telehealth and integration of digital and behavioral tools, especially in rural and low-income populations. Together, these strategies improve outcomes and equity in care. Based on my review, some recommendations can include developing workshops and online resources for adult ADHD management for health educators, employing integrated care, combining pharmacologic, behavioral, and AI-assisted interventions for practitioners, and expanding telehealth coverage and promote adult ADHD screening programs for policymakers. It's important to mention that AI applications bring serious ethical concerns. Data privacy and informed consent are critical. Algorithmic bias can create disparities. So to mitigate risks, AI systems should be transparent, use diverse and inclusive data sets, and prioritize equity in care delivery. So in summary, adult ADHD is prevalent, but underdiagnosed, with significant personal and societal burdens. Evidence supports integrated treatment combining medication, behavioral interventions, and AI-enhanced tools. Public health strategies focused on awareness, access, and equitable care can improve outcomes for adults with ADHD. And by integrating behavioral science, technology, and equitable practices, we can ensure adults with ADHD receive the care they deserve. Here are the key references that informed my review and this presentation. And I just want to say thank you so much for listening today. Hope you learned something today.